Now it's time for our bonus round and the hot takes, which is turning out to be one of our most popular initiatives here on Fromm and Fuller. And Al, you get to go first.
Well, over as the big beautiful bill or big beautiful disaster, as I call it, has been debated. Most of the focus has been on the Medicare cuts, but there are a couple of other things happening in the healthcare world, which I think may even have more impact. They're not at the scale of the damage that the Medicaid cuts could cause, but as usual, Congress in the bill put off those cuts until well after the midterm elections. But just two things. This week, the numbers came out, and there are more measles cases in the United States this year than any time in the last 3 decades, and it's possible that I don't know who the international body who does this is, but measles will be declared as not being eradicated in the United States, which it has been for I think more than 2 decades. As we learned with the pandemic, those kinds of things can spread, and that's something that would affect people where they live. There's another thing that I happened to have a virtual visit with my doctor yesterday, and he wanted to schedule another one, but in 3 months. But the Medicare rules are now allow Medicare to pay for virtual visits. As of October 1st, those visits will not be paid for on Medicare. Now, for people like me, it's not a big deal. I can get up and go to the doctor's office. But in rural areas, it's going to make a big difference because in order to have a televisit on under the rules, as they will be unless Congress acts, after October 1st, you'll have to go to some sort of a rural health center. And now, the televisit deal was put in for the pandemic, with COVID, and so it had a lifespan, and I think it was extended once or twice, and now it looks like it may end. But as we've learned in so many different walks of life, COVID's really changed patterns of life in the country. And I think this is the kind of thing that can be disruptive to people in their everyday lives.